I would give you half of my liver, Heather. I would.
I'd give you half of mine.
This is On Nutrition, a podcast from Mayo Clinic where we dig into the latest nutrition trends and research to help you understand what's health and what's hype. I'm Tara Schmidt, a registered dietitian with Mayo Clinic in Rochester, Minnesota. This episode, liver health. But first, we have a listener question from Pamela about our episode on protein called Debunking the Protein Propaganda.
Hi, I'd love to be more plant-based focused for getting my protein, but I'm kind of hung up on getting complete protein since I'm into my 70s and want to make sure I'm doing all the right things. Oh, one more thing too, about the carbohydrate usage, like the beans and rice. I'm concerned about how many carbs are in that, mixed in with that in order to get the protein and, sort of how do I balance that throughout the day. Thanks very much. Bye now.
Hi, Pamela. A lot of older adults aren't meeting their protein needs, so you're on the right track when it comes to being mindful of your intake. So to answer your question, let's start with understanding protein at a molecular level. Protein is made up of amino acids, and while your body produces some of the non-essential ones, we need to get some of the essential ones through our food in order to function properly. Foods like eggs, dairy, poultry, beef, fish, but also some plants like soy and quinoa are complete proteins, meaning they contain all 9 essential amino acids. Incomplete proteins, often plants like nuts, seeds, and beans, don't deliver these in adequate amounts. But that doesn't mean they're not nutritious. It just means we have to do some combining in order to get the whole package. Examples of these complementary combos include peanut butter on wheat bread, or your example of beans and rice. Remember that these don't necessarily need to be eaten at the same meal or every meal. The goal is to balance them throughout the day. In terms of portion, meal balance, and controlling for carbohydrates, just think of the plate method. Aim for half of your meal to be fruits or non-starchy vegetables, 1/4 of your plate as a plant or animal-based protein, and the last quarter as a whole grain. This ensures you get protein at each meal, but also a variety of other nutrients. Thanks for your question. If you have another follow-up question, leave us a voicemail at 507-538-6272, and we'll answer it in a future episode. Now, on to the show. About 4.5 million American adults have been diagnosed with some form of liver disease, and some portion of those patients will go on to need a liver transplant. What interventions are available so we can avoid that procedure? And if we do get a transplant, how can our diet support our new liver so it stays as healthy as possible? Thankfully, we have one of the best in the biz here to help us understand. Heather Bamlet is a transplant clinical dietitian at Mayo Clinic in Rochester, Minnesota. She helps transplant patients of all kinds prepare for and recover from their procedure and knows all about how to avoid, and in some cases reverse, certain liver diseases.
Hey, Heather, welcome to On Nutrition.
Yeah, thanks for having me. I'm kind of nervous and kind of excited all at the same time. So
You are the expert. And I think this is such an important topic, especially when we're going to use one of my least favorite words, which is detox. And I'm sure you might even hate it more than I do. Is that true? Do you hate that
just
word?
a little bit, probably.
Okay.
I do. Yes.
We're both like cringing right now. Because the internet just loves to talk about, quote unquote, detoxing the body. I like to tell them about what organs they have that do that for them. But let's play a little.
Exactly. Yeah.
Let's play health or hype. So can you tell me if any of these are health or hype when it comes to ridding the body of our toxins? Are you ready?
Yep, absolutely.
Okay. Aloe vera juice. I've had this before. It's pretty good.
Yeah, I would say from the idea of actually detoxing the body, probably hype. Best study I found to kind of back up my claim to hype here is in 35 healthy individuals, 7 did not complete the study because of the GI side effects that aloe vera can have. And at the end of the study, which I think was 12 weeks, no improvements in what they were looking for. So I think
It's
pretty
also
much
really sugary, I think.
that's really true. And as we talk about liver disease and metabolic associated things, sugar is kind of the thing we want to talk about a lot. So yeah.
All right. Kiwi. I'm
Kiwi.
cool with the kiwi.
Yeah, absolutely. Kiwis have tons of good antioxidants, lots of fiber, all of those good kinds of things. Where I think this one comes from is in rat models, kiwi is actually shown to help reduce cholesterol, but we haven't seen that translated to humans, and nobody's going to follow a kiwi only diet. So I think this is one you want to incorporate. Great, high fiber, lots of antioxidants, good
Yes.
stuff. But to say that it's going to make your liver detox better, don't think so.
Flax seeds.
So flax seeds are kind of really interesting to me in terms of detox. Yeah, maybe not so much, but a couple of studies really kind of show people have up to 30 grams of flax in a day, which is like a couple of tablespoons worth. We actually can see reduced amount of fat in the liver, which of
Okay.
course in the end is going to help the liver do good things. So maybe a little bit of truth to this one, but do I think it's going to make the liver actually like detox better? Nah.
Magnesium. We both know our wonderful, genius, and lovely colleague, Joy Heimgardner, who we had a whole episode on magnesium. What from your specialty are we talking about with magnesium?
Yeah. So if we kind of just think about the liver, magnesium's involved in a lot of the different kind of pathways through the liver for reducing toxins and things like that. However, if someone's healthy and has normal magnesium levels, taking extra is not going to make that better, right? We're just going to have higher magnesium urine in the end. So,
And is that true of all supplements that we're talking about, that like the more supplements we're taking, the more work the liver has to do?
in a sense, right? Because we need to
Right?
get rid of it, either the kidneys or the liver, the two
Yeah.
things that help detox our body have to do that extra work. Absolutely.
And then lastly, supplements in general, right? Is there any supplement that actually helps the body rid itself of toxins?
I wish I could say yes. It'd make my
Mm.
job a whole lot easier.
You're like,
There's
"Bye."
some big meta-analysis where they went and they looked at like the liver detoxing supplements on the market, and by and large, no real health literature to back up the claims. Save your money.
There we go. Just expensive pee, everyone.
Yeah. Yeah.
Is this true that the liver has over 500 functions?
Yeah.
What are some of the main responsibilities, like top, however many you want to give us?
Yeah. So as like a dietitian, I'll focus probably on mostly the nutrition related ones. Our liver helps us to make bile, which helps us to break down and absorb fat. So that's an important piece. Our liver makes cholesterol, which is usually a good thing. We need good cholesterol levels in our body. But if somebody's got a genetic condition where it overproduces, well, maybe we need to kind of watch that there. Makes certain types of proteins, of course, kind of clears the blood of toxins, stores different nutrients, is involved in helping to regulate our blood sugars, especially during times of fasting. So that's a key component. And all of these things involved in like every second we're awake, every second we're alive.
Tell us more about your job and the types of patients that you work with and how you help patients with their liver health.
Yeah. So I am a solid organ outpatient transplant dietitian, which means when I first meet most of my patients, they have liver disease that is going to require transplantation for them to get better. And essentially, I'm talking to patients about how do we eat around what your liver's not doing for you, which I think is kind of an interesting take on it. Like I said, the liver does help to regulate blood sugar through releasing glucose into the blood when we're fasting. And if that's not happening, the body starts to break down muscle and fat like crazy. And of course, if we're thinking about putting somebody into the operating room, I want them to be as strong as possible.
Mhm.
And so we talk a lot about how do we eat around that? How do we feed you so that doesn't happen? Your body never has to knock on the liver asking for that glucose, essentially. We work with people pre-transplant who were very, very sick. And it's a different kind of conversation than we have post-transplant when the liver
Mhm.
is now new and healthy. And how do we keep it healthy? And in that kind of setting, we're talking a lot about blood sugar management. We're talking a lot about restoring and rebuilding muscle mass. We're talking a lot about just keeping blood sugars under good control, helping to keep cholesterol levels, triglycerides, all sorts of things in good levels so that we don't put fat in the liver. We don't cause long-term issues with the new liver.
And we're going to get into how you advise those patients later. But for someone with, let's say, a healthy liver, how can what we eat negatively impact it? Are there preventive strategies to keep it healthy?
First and foremost, I think when we talk about keeping the liver healthy, for those of us who have a healthy liver, moderating any kind of alcohol consumption, because alcohol does cause damage to livers. A high kind of sugar diet, like added sugar, honey, all of the sweet maple syrup. We should really try to keep our sugar intake or our simple carbohydrate intake down. The way that I've heard it best described is when we consume, especially sugar sweetened beverages, we can get this like spike in blood sugar levels.
Mhm.
If everything's working, the body wants to package that up right away. One way it does that is high blood sugars, high triglycerides. Triglycerides like to deposit themselves as fat inside our livers, and we're trying to avoid fat getting into our livers as much as possible. And so that's a really important component. The other component is we all have a little fat in our livers. That's normal. What we don't want to have happen is that that fat becomes inflamed. We don't want inflammation in the liver. And so kind of a diet that includes lots of anti-inflammatory foods, lots of fruits, vegetables, all of those bright, beautiful colors. Each of them has their own function to help with something. And we want to incorporate a wide variety of those so we help to prevent that inflammation.
So we talked about alcohol and sugar. What other factors put stress on the liver?
Yeah. So carrying any excess weight, that puts more stress on the liver. One, from having that fat maybe deposited in it, but two, like if you think about the liver has to clear toxins from the whole body, well, the bigger the body, the more toxins the liver has to remove, right? Smoking can be a stressor as it is for many things in our body. Excessive intake of like over the counter medications, like too much
Okay.
Tylenol, things like that can be stressors for the liver. Lack of sleep. I mean, like
Oh,
everything that puts stress
wow.
on our bodies, right, can stress out other things.
Just your basic good old health advice, everyone.
Basic good old health advice. Absolutely.
Now, I feel like it's a little bit also trendy to be learning more about ourselves and our health, which great. I support that. But sometimes I catch it in the realm of people getting unnecessary testing or testing that isn't validated, et cetera. Now, there's a legit test for liver function, right? Or liver enzymes. Who needs to be getting their liver enzymes tested?
That's a really fair question. And as a dietitian, I'm going to always defer that back to primary care physicians, hepatologists, whoever maybe our patients are seeing. But in kind of general, big picture, anybody who carries any excess body weight, anybody with diabetes, hypertension, high cholesterol, big scheme, anybody who drinks alcohol, which probably is a lot of us, right? And certain people who maybe take certain medications should also have their liver screened. Chemotherapy agents, things like that. We should be screening for liver enzymes to make sure that the liver's not taking too bad a hit with those.
So we often associate liver dysfunction with jaundice, right? That's very visual for us. The skin and the eyes can kind of get a yellow hue, but there are obviously some conditions that are not as evident from the outside. Are there any indicators, and what may they be, that someone should be seeing a doctor about the health of their liver? Does that exist?
Yes and no. So a couple of things like rapid weight changes
Mm.
potentially, or somebody who's been going along and all of a sudden they've got like massive edema where their legs really get super swollen, or they feel like their abdomen gets kind of really full with fluid. They're not
Hmm.
pregnant, but they look like they're 9 months pregnant. Those could be signs that like the liver's really not working very well. Other things like itchy skin can be a sign that bilirubin's kind of building up in the blood. One that's kind of uncomfortable to talk about, but like if you're noticing a change in the color of your stool, if it's normally kind of brown, but now it's very light tan, almost gray or white, there's a sign that bile's not moving through. If it's floating a lot, sometimes that can be a sign of, is there too much fat coming through? So the bile's not helping us to absorb it.
Yeah, fat malabsorption.
So there's some of those kinds of things that are important. Sometimes you'll see like fatigue. Well, I think we're all fatigued,
It's like
right?
raising my hand.
Right? Like, yeah, here's me. But that would be maybe a sign that you should see your doctor if that's, not explainable. And then kind of, what is it? Is it thyroid? Is it liver? Is it what? Right?
Is it your
Yeah.
kids? Is it your job?
Could be all of the above, right?
While there might be plenty of voices online telling you to try magnesium, flax seeds, or kiwi to detox your body, one of the best tools is already inside you, your liver. Your liver has over 500 functions, like filtering blood, making bile, and regulating blood sugar. And supporting it isn't about special cleanses. It's about basic health habits, staying hydrated, limiting alcohol and added sugars, not smoking, prioritizing sleep, and not overusing medications like acetaminophen. If you're experiencing swelling in your legs or abdomen, itchy skin, pale or floating stools, unexplained fatigue or jaundice, you may need to get your liver enzymes tested. But you may also need to get tested if you have diabetes, high cholesterol, obesity, drink alcohol, or take certain medications too. Now that we know the signs that something is amiss, let's talk about the most common forms of liver disease related to our diet. Heather, we used to use the phrase fatty liver disease, but now that covers a spectrum of conditions under the umbrella of metabolic dysfunction associated. Why did we stop using the phrase fatty liver?
With the fatty liver, it kind of implied it only happened in people who carried that excess weight. And I think that still gets thrown around some, but I think the heart of really why is it's not just like fat, it's also blood sugar control. It's also some of those other metabolic factors. And so calling it metabolic dysfunction associated gives a better look at what's really going on. It's not just simple fat, right? The other thing that I think is really important to note is that metabolic associated doesn't necessarily have to be in someone who's like overweight or obese, although that's one of the components of it.
Mm-hmm.
We can see some of those things for even very like thin people too.
So what used to be fatty liver disease is now this kind of spectrum of conditions, starting with MASLD, which, thank goodness, is an acronym. It stands for Metabolic Dysfunction Associated Liver Disease. Did I get that right?
You got it absolutely right. MASLD, or the metabolic dysfunction associated liver disease, is that complex kind of thing that happens where blood sugars can be elevated. We can see high cholesterol levels, high triglycerides. There's fat in the liver, excess fat, more fat than we want in the liver. Just like extra fat, my underarm or other places on my body, we can reverse that, which is like the super cool thing. We can change diet, change exercise habits, maybe think about one of your favorite topics, GLP-1s, things like that to help reduce maybe that extra body weight, help to bring cholesterol, blood sugars, all those things back into better control. We can see that fat go away, kind of melt out of the liver like it does in other places.
Okay, and then MASLD can develop into MASH, or metabolic dysfunction associated steatohepatitis. What's happening here?
This is where the liver now becomes inflamed. So before it's just kind of hanging out there, it's got some extra fat. Now it becomes inflamed. And why? Could be a medication, could be an infection, could be just inflammation in the body overall. And that inflammation can lead to fibrosis in the liver. So the liver starts to get a little bit stiffer, doesn't kind of work quite as well. And then kind of beyond that, if that doesn't get under better control, it can become scarred or cirrhotic, which is then when they come to see me in transplant world. In my simple way of dietitian thinking, MASLD can lead to MASH, can lead to cirrhosis.
Yeah.
That continuum. Makes sense?
So I'm hearing that MASLD is reversible. What about MASH?
to a certain extent. So if we get like too far towards the scar tissue, too much scarring, that kind of thing, the liver's not as able to kind of fix itself. But the liver is one of the organs in the body that can regenerate itself.
I know, it's so crazy.
It's the craziest, coolest thing where even like in my transplant world, we can have a living donor liver transplant where the donor gives up a hefty portion of their liver. And within a very short period of time, both people have a fully functioning liver, which is like
I would give you half of my liver, Heather.
coolest thing.
Would.
I'd give you half of mine. But it's like, it's such a cool thing. But we could, like, that can be used to our advantage. There's damage to the cells and they can repair themselves. We need to get some of that fat out of the liver. So weight reduction is a huge thing with MASLD in the big, big picture. Some of the research says a 7 to 10% reduction in body weight, we really see that fat come out of the liver. Outside of like weight changes, some of the stuff that gets me really excited with the MASLD group is regardless of weight change, some studies have shown just increasing physical activity to that point of like the average of 30 minutes a day, just that increase in physical activity helps to reduce the amount of fat in the liver. So there's so many things that can help at that MASLD stage. And even at the MASH stage, if we're not like too far towards the end of that spectrum, there can be some reversal and some healing there.
So pretty general weight management guidance, right? Intentional activity. I always say, like, I want you to challenge your muscles, either with strength training or with cardio, which then you're challenging your heart. Like something needs to be working fairly hard, right? When you have someone who's super motivated to potentially have this reversal, do we also have them completely avoid alcohol? Would that be the best scenario?
Yes, absolutely.
Okay.
Alcohol makes MASLD worse. Period. The end. And so if we've already got this thing going on, because alcohol damages liver cells as it's being detoxed, if we want to use the word we started with, right? In the setting of something that's already kind of making the liver not as happy as it could be, yes, we should avoid alcohol. If somebody's super motivated, we talk about, I call it a modified Mediterranean diet.
Same.
Modified in that a true Mediterranean diet promotes the use of like red wine. Don't want that. But what we're really looking for in the red wine are a certain group of antioxidants, and we can find those in red grapes and blueberries and purple cabbage and even super, super dark chocolate. As you know, Tara, we have tons of education materials around the Mayo Clinic for every topic you could ever imagine. And we don't have a lot of nutrition education. This is just don't do this.
Because it's not black or white, unless you're allergic to the peanuts or unless you have MASLD.
Exactly.
Don't drink the alcohol.
Exactly. And the research behind especially sugar-sweetened beverages in MASLD is strong enough that we went ahead and in our like, hey, this is how you help your liver out book, our nutrition guidelines for people who have MASLD or want to prevent it. We say, don't drink sugar-sweetened beverages.
Let's talk more about cirrhosis. And I think that a common misconception is that it's usually or often related to alcohol use, but that's not always true. And I think the former kind of acronyms that we used to use said like non-alcoholic fatty liver, et cetera. Tell us more about that.
Yeah, so cirrhosis is where the liver becomes very scarred, very hard. Those cells there are not doing all the filtering and all their 500 tasks that they're supposed to do. And so it doesn't have to be related to alcohol, though can be. The damage that alcohol causes can also be that MASH becoming cirrhosis. We can see it with like hepatitis B, hep C, where that leads to cirrhosis. And so if we think about it that way, there's many causes, but definitely if we're looking at a MASLD MASH kind of picture, that can be kind of diet and lifestyle related.
Are there any other common liver conditions that are lifestyle related that we haven't talked about?
We've got alcohol, the kind of MASLD MASH look at things. Lifestyle-wise, if we think about that MASLD MASH kind of picture, someone has really poorly controlled diabetes, like they choose just not to take care of it. Can that lead to MASLD and MASH down the road? Yeah, absolutely.
Okay.
Somebody who takes a ton of supplements without knowing what's in those can also cause like liver damage. And then that damaged liver can become scarred, can become cirrhotic. We've needed to transplant people because of different supplements on the market that have just been sold to them
That's so
and their
scary.
body doesn't do. It's scary. And then the other probably big one that hopefully we don't see quite as much, but would be like IV drug use, tattoos with unsafe, needles, things like that for some of those blood things like hepatitis
Yeah, the
C.
hepatitis. Okay.
Yeah. Yeah.
So we know that the liver is the only organ that can regenerate itself. Is that only in a healthy liver?
So when we think about people with MASLD or MASH being able to have some repair, not necessarily, but a fairly healthy liver. There
Okay.
does come kind of a point of no return with the liver where it becomes so scarred, so cirrhotic that liver transplant is the thing that's
Okay.
going to help.
What are the most common causes of liver transplant?
MASH-related cirrhosis is the second leading cause of need for liver transplant in the United States behind alcohol for people who don't have a certain kind of liver cancer called hepatocellular carcinoma. So it's the second leading cause for need for liver transplant with it, which is huge, right? For people who don't have that hepatocellular carcinoma, in 2013, 19% of transplants were related to MASH-related cirrhosis. In 2022, 27%
Wow.
of those liver transplants were because of MASH-related cirrhosis. That's a huge increase.
Heather, after a patient has been diagnosed, I think you referenced this in we're not doing alcohol, we are not doing sugary beverages. After they've had a transplant, right? Here you go, Heather, here's part of my liver that's hopefully healthy and stays that way. Do we still need to avoid alcohol?
Yes.
Okay. Don't take the risk of the nice present that I just gave you.
Correct. Absolutely.
So there are two main liver conditions related to diet, MASLD and MASH, which used to be known as fatty liver disease. MASLD, or metabolic dysfunction-associated liver disease, is related to blood sugar control, high triglycerides, cholesterol issues, and excess fat stored in the liver, even in people who appear thin. The good news is that at this stage, it's often reversible, with minor weight loss, 30 minutes of daily intentional movement, improved nutrition, and avoiding alcohol and sugary drinks. If MASLD progresses, it can become MASH, metabolic dysfunction-associated steatohepatitis. This is where the liver becomes inflamed. Then inflammation can lead to a stiffened condition known as fibrosis, and eventually cirrhosis, which is severe scarring. Contrary to popular belief, cirrhosis isn't always caused by alcohol. It can be a result of hepatitis B or C, poorly controlled diabetes, or certain supplements. Some cirrhosis damage can be reversed if caught early because the liver is the only organ that can regenerate itself. But once scarring becomes advanced, there is a point of no return where a transplant may be necessary. MASH-related cirrhosis is now the second leading cause of liver transplant in the US, and cases are rising. Even after a transplant, patients are advised to completely avoid alcohol to protect their new liver. Now let's talk about what happens after a liver transplant, why so many kids now need one, and how else we can keep our livers healthy. Why do so many transplant patients gain weight after their surgery?
I think about it two ways. One, we know that your anti-rejection, those post-transplant meds, can kind of predispose some of those things like elevated blood sugars, those kinds of things. The average person post-liver transplant, some of the averages that got thrown out are like most people gain 20 to 30 pounds within the first year of their transplant.
Which is not always bad, right?
Right.
Because they may have been malnourished in the first place.
Yes. And that is something that I'm always careful to point out.
Okay.
Is with cirrhosis, malnutrition is a very, very, very common thing. It's the thing that I deal with and fight with our patients pre-transplant every single day I come to work. How do we help you become less malnourished? How do we prevent malnutrition in the setting of cirrhosis? So some weight gain for some people is a really good thing, but most people will kind of see that above and beyond what their goal weight was. Why? I think it's a complex, like massive, a whole bunch of different things. But I think the heart of a lot of it is pre-transplant. Most people lose a ton of muscle mass. They just do. And post-transplant, we can be eating what would be considered perfectly normal amounts for ourselves. Yet with that decrease in muscle mass, we don't burn nearly as many calories and
Yeah.
weight gain becomes really, really easy. And so I am always, always, always stressing how important it is that we rebuild that muscle mass for those patients.
This is another stat that kind of stresses me out when you were talking about the need for transplant and the most common causes of transplant. We've got a big one going on, especially in America, with kiddos. So we know about 5 to 10% of kids in the US have some sort of liver disease, and that's about the same rate as asthma. What is leading to that statistic? Because I do not think that that was true 10, 20 years ago.
I will preface this by saying I am not a pediatric dietitian. However, I think what we're seeing in terms of trends in adults, we're also seeing in kiddos, right?
Yes.
So there's more access to, high sugar foods, more obesity, higher
Mhm.
rates of even things like type 2 diabetes,
Yes.
more of that insulin resistance, all of those things, less activity.
Yeah.
I think about how much time kids spend watching TV, on a computer, on their phones. When I was a kid, my mom and dad would like kick us outside. Don't come home until the light comes on at the end of the driveway, right? I don't see that now. And I think that kind of combination of moving less in a lot
Mhm.
of cases and eating more or more calorie dense, more sugar dense kinds of things, what we're seeing in the pediatric population is echoing what we're seeing in the adult population.
Absolutely. And this is never meant to be about shaming parents or, you need a little screen time to
No.
do the dishes. However, what can you do, right? What foods can you bring in the home? What foods can you limit in the home? What foods can you save for special occasions?
What can we do inside, right? How can we kind of, you know, up and down the stairs or dance parties or whatever,
Yes.
just to kind of really get moving, going more.
We mentioned doing a modified Mediterranean diet earlier for patients with MASLD. Does that advice continue for liver transplant patients?
Yep. For any kind of transplant, not just liver
Okay.
transplants, because the interesting thing about my role in post transplant time is the anti rejection medications people take after transplant are really kind of very, very similar, if not the same, regardless of if it's a liver transplant, heart transplant, lung transplant, kidney transplant. And they can all cause elevated glucose levels and changes in
Mm.
cholesterol levels. And so we are trying to get everyone on a good heart healthy, liver healthy eating plan. I oftentimes tell people if you've had a kidney transplant, you don't want to show up back at our door needing a liver transplant in the future. And
Yes.
so these are things that help us keep your liver healthy too when we know we might predispose you a little bit. The other piece that I didn't say with the Mediterranean diet where we modify is true Mediterranean diet doesn't put much limit on like olive oil and some of those added fats.
Yeah. It's pretty high in fat. Mhm.
Fats are calories in the end, even though it's good calories, right? It's still extra calories and excess calories. And so if we're trying to prevent that unwanted weight gain, we also need to think about, if not calorie restriction, calorie moderation in the body so that we don't overshoot the mark there.
Yeah, so we still do the unsaturated fats. We still do the healthy version most often of the fats or the replacement, but we just need to be mindful that for every gram of fat, there's 9 calories, and that's the most calorie dense nutrient out there. Okay.
Yep. Yep.
Coffee.
Yeah.
I've heard some, I believe to be legit research. Is this good for our liver? And what kind of coffee?
So in the beginning, we were talking like hyper health, right? I'm going to
Yes.
say coffee gets the health. So like plain black coffee with a little milk or
I was
almond
just going to
milk
say,
or
yeah.
kind of something like that. Not terribly problematic at all to add something like that that would be part of our healthy diets anyways. But the research really shows that less risk of that fat developing into like fibrotic tissue and cirrhosis with good coffee intake. In fact, if I pulled it up in front of me, I've got a 13-page paper all about the benefits of coffee for people with liver disease. There's a whole bunch of antioxidants in
Yes,
coffee
yes.
that, like, is it a synergistic effect where they all help, or is it a specific one? I'm not sure in my reading, but high coffee consumption, 3 cups a day,
Right.
has been shown to help reduce that like progression towards more severe forms of liver disease, if you will. We actually have a hepatologist here in transplant who tells patients drink 3 strong cups of coffee a day. Like the evidence is pretty strong.
Can it be decaf, though? Because you told me that
Yeah.
sleep has
Yeah.
to be good, too.
Yeah.
So does decaf
So
count?
decaf counts too. So I oftentimes will counsel people that if you haven't been a caffeine drinker going from 0 to 3, oh,
Yes. What about intermittent fasting? Are there benefits to the liver if we give it kind of a break, let's say?
the research was kind of, I would say, mixed in terms of that. There was a big meta analysis of different types of, so meta analysis, for those who don't always read these studies and things, let's look at all the studies and like condense it down and say, what do all of these studies say? And the researchers who did the big analysis were really careful to say, it wasn't just like length of eating or eating windows or like, did I eat every other day or whatever that intermittent fasting looks like, but also composition of diet made a
Yeah.
big difference. And so I think for many people who don't have cirrhosis, and I want to make that like perfectly clear,
Yes.
when we get to the point that the liver is not doing that blood sugar regulation during times of fasting, we don't want intermittent fasting. In fact, I want people to eat like all day long when that's starting to happen. But for people who have, like, say, MASL, they've got some fat in their liver, they're working on that 7 to 10% weight reduction, and they come in, they're like, hey, I want to try this intermittent fasting. Okay, let's say, like, how does this work for you? How does this not? But we also want to think about, like, what are you going to eat during your windows? So if somebody is, say, like an evening time, like high calorie, high fat, high salt, high whatever kind of snacker, and they say, I'm going to only eat within a 10-hour window. I'm not going to eat after 7 o'clock at night, and I'm not going to eat till I get up tomorrow morning. Well, if you're not eating some of those high calorie, high fat, high sugar snacks,
We'll take
yeah,
it.
you're going to lose weight. And if telling yourself that I'm just not eating after that time helps you do that, more power to you there.
Have there anything else listeners should know when it comes to liver health?
Just a brief word on alcohol. Moderate consumption for people who don't have liver disease, as of today, is still defined as 2 drinks a day for men and 1 drink a day for females. But what I think is a really important thing to talk about is, what is a drink defined
Yes.
as? And what I would challenge people who do choose to have alcohol is to pour 5 ounces into a glass. Get out your liquid measuring, pour it into your wine glass. Most of us, if we do consume some alcohol, are consuming more than we think we are. And that's an important piece that I don't think always gets talked about, because what's a pour? What's a drink?
Yeah.
And I encourage people, bust out that measuring cup, really know what you've got so you're not essentially lying to yourself.
Heather, thank you so much for your time today. I just want to thank you for bringing all of your knowledge and experience to the podcast today.
Thank you for having me. Hopefully we reach someone who goes, I can do that. I can
Yes.
protect my liver. Because the best thing in the world for me would be people who have MASLed, they all reverse it and they never need to come see me in Transplant World.
The liver is one of our most resilient organs. It can regenerate itself, but there's still things we can do to keep it in tip-top shape. If your liver is relatively healthy, try measuring the amount of alcohol you're drinking. It might be more than you think. If your child is at risk for liver disease, encourage them to stay active and do what you can to reduce their intake of ultra-processed foods. If you have MASLed or MASH that hasn't crossed into cirrhosis, intermittent fasting might be a good option, as long as the composition of your diet is fairly healthy. Later stages of liver disease might benefit from 3 cups of black coffee a day and a Mediterranean diet without the red wine, along with a reduction in healthy fats like olive oil. And if you've had a liver transplant, it's normal to gain weight. What's important is that you prioritize strength training to regain the muscle mass you've lost. No matter where you are in your liver health journey, it's never too late to make a change. That's all for this episode, but if you have a follow-up question, leave us a voicemail at 507-538-6272, and we'll answer it in a future episode. For more On Nutrition episodes and resources, check us out online at mayoclinic.org/onnutrition. And if you found this show helpful, please subscribe and make sure to rate and review us on Apple Podcasts or your favorite podcast app. It really helps others find our show. Thanks for listening. And until next time, eat well and be well.
This podcast is for informational purposes only and should not be relied upon as medical or legal advice. Always consult with a qualified healthcare provider for any medical questions. The appearance of any guest does not imply an endorsement of them, their employer, or any entity they represent. The views and opinions are those of the speakers and do not necessarily reflect the views of Mayo Clinic. Reference to any product, service, or entity does not constitute an endorsement of or recommendation by Mayo Clinic.